suffering from breast cancer.
Yes.
And they were going through the chemotherapy because already they were beyond stage number 5. And they got complementary to the chemotherapy, they got some herbal preparation which is called Amrit Kalash. It's a paste and a herbal tablet. And the doctors were observing that all the side effects like vomiting and losing weight, feeling dizzy, that they were reduced significantly. But then the other ladies who were in the control group, they observed that the others looked better, were feeling better. They found out and they also got it because it's available there in the pharmacies. And then there was no study, there was no control group. And then our colleagues in India, they approached the All India Science Institute and asked them to conduct a real scientific study, a randomized, double-blind controlled study. And it was first not possible because by law, you may not do studies on human beings. But then they convinced the ethic committee of the Indian Parliament. It took some time. And then they had to face a big challenge. It took them about 6 months to produce the placebo. That means they had to develop the paste and the tablet that looked the same, that taste the same, but they don't have an effect. And then they had 200 ladies going through the chemotherapy, other ladies, and half of them got Amrit Kalash and the other got the placebo. And they found out that in 20 categories of side effects, there was an average reduction of 50% with the ladies who took, in addition to modern medicine, the Amrit Kalash. And I think every woman in this country and all the people responsible for health, they should look at those studies and really introduce it here because it could really reduce a lot of suffering. And also the budget of the healthcare system would be benefiting from that.
Ayurveda has been practiced for so many years, Lothar. How many people are practicing today? I know it started in India.
Yeah.
And I'm just wondering if you could talk about, do people use Ayurveda for a complete healthcare system in India?
Yeah.
How effective is it? And what's your vision for the United States for Ayurveda? And what would you like to do in establishing these clinics all around?
Well, in India, about 80%, especially in the rural areas of the population, they're using Ayurveda, but they use only fractions of it. And Maharishi Ayurveda really put together all the different approaches that were lost to make it more effective because it is more complete. And in Germany, we have hundreds of thousands of people who went through these Panchakarma treatments in the clinic. It's really become a household word. And in America, unfortunately, only 0.2% of the people know the word Ayurveda in America.
Only 2.2%.
Right. So we have to do a lot of promotion here. And I think if the health insurances would really look into the research, and if the health departments of the various governments here would look into the research, it would be possible to implement it within a few years, And the doctors, the medical profession here, they could get some upgrade in their training, just a few months, because they have already all the knowledge about autonomy, and just a few months of training. And we have a Medical Doctors Association in America that is offering these advanced training programs. And in this way, it could be introduced very easily in society. And I really think it's possible to create something that is our goal, which we would call a disease-free society.
That's a wonderful goal. I know right now there's a crisis in healthcare.
Yeah.
We just can't afford to pay for it, and it's not producing good health.
Yeah.
So this seems like a very natural solution.
Yeah.
Now I know you're traveling in a few days up to Canada.
Right.
And can you tell us about your plans for the future? What countries are you going to be going to, and will you be establishing these Ayurveda health clinics in the U.S. and other countries as well?
Yes. Well, I have requests currently from about 15 countries to open clinics, and I have to multiply myself. So I'm starting to train managers in Lancaster, actually, that would go to different countries to open clinics there.
That's wonderful. Well, we've got just a couple of minutes left. So I'm going to ask you if you have any few closing remarks that you would like to say before we tie this up. It's just fascinating having you here and hearing about Maharishi Ayurveda.
Well, I would like to invite all the viewers to come here, really, to come to Lancaster. We have open houses. Visit our website, which is www.lancasterhealth.com, and come to one of our open house seminars. They're for free. And if you can afford it, just come for a consultation, a wellness consultation. And then I would also recommend all the listeners, viewers, to come here to the center in Shrewsbury to hear more about the benefits of transcendental meditation, and visit the website tm.org.
Well, thank you so much, Lothar, for coming and talking with us today. And this is one of the goals of our show, is to bring this knowledge and information out to as many people as possible, because we want to show people that you can have, better health, more happiness, more creativity, more inner peace in a very, very natural way. And it sounds like Maharishi Ayurveda is very cost effective. It's going to solve some very significant problems in this country.
That's right.
And people are actually going to be much healthier.
Right. I would say only a new seed can yield a new crop.
Yes.
And this is a new knowledge, even though it's ancient, and it was my very great joy and pleasure to come here. Thank you for inviting me.
Thank you very much, Lothar, for being here this evening. And thank you, our listeners, for tuning in, and we'll have our next show in about a month. Thank you so much.